as we're increasing the capacity of the labs, okay, so now our 300 labs are getting more equipment, more supplies, they can do more tests. Now we need more collection mechanisms, more places to collect the test data so they can send it to the labs, right? It goes collection, then send those samples to the labs run those samples, get the results back to the people. We have boosted the lab capacity to an extent where we need more collection sites now. So where do you get collection sites? We're going to authorize all the independent pharmacists in the state to be collection sites for testing. I assume, and my guess, and my educated guess, is that independent pharmacists will take us up on this. And there are 5,000 pharmacies in New York State. Some of them have already been doing it, some of the larger national chains, but if your local drugstore can now become a collection site, people could go to their local drugstore. There are about 5,000 in New York. They would be collection sites that would quickly ramp up our collection capacity. So we're doing that. And since we now have more collection sites, more testing capacity, we can open up the eligibility for those tests, right? We had a protocol with eligibility. Not everybody could get a test. And that's been a big complaint across the board. Everybody wants a test, and they couldn't get tests because we had a tight screen on the eligibility because we had a limited capacity to test. As you increase the capacity to test, you can increase the eligibility. And first responders, healthcare workers, and essential employees. Why? Because these people have been carrying the load, and they have been subjected to the public all during this crisis, and because they're public-facing, right? These are the people who you interact with. You get on a bus, this is the bus driver. You get in a subway car, this is the subway conductor. You are interacting with government, these are the people who you're interacting with. If they're infected, they could possibly spread it to a large number of people.